Guess we'll go ahead and get started. Good afternoon. My name is Joe Hines, and I want to welcome everybody to the APA Women in Pancreas webinar. The APA has a long-standing history of supporting this event, usually in person, but we're welcome to have you. We're excited to have you here, and there's a great program for us over the next hour. I wanted to start off by reminding everyone that we're planning to have an in-person meeting in November at the Eden Rock from November 3rd to the 6th. And now's the time to start submitting your abstracts. Those were due by mid-June. So we're excited and making plans for that already. And I also wanted to thank our sponsor, AbbVie, who's given a very generous support for the session today. We're very glad and appreciative of their partnership. I'm going to introduce our moderator, and then we'll go from there. So Dr. Alia Uch is a professor of pediatrics and gastroenterology and also radiation oncology at the University of Iowa. She's the division director, and her research is focused on cystic fibrosis and how it's related to pancreatic disease, in particular, both acute and chronic pancreatitis in children. She leads the INSPIRE program, or the International Study Group for Pediatric Pancreatitis. I'm going to turn it over to Dr. Uch, and looking forward to the session. Dr. Uch.
Thank you, Joe, for this wonderful introduction and welcome and the opening remarks. And thank you everyone for attending this webinar. We're excited to have it. We would normally have this session at our annual APA meeting. It would be a very well attended session with excellent discussions. Due to the COVID restrictions this past year, we had the virtual meeting, and this meeting was converted to a webinar. So we have excellent topics and excellent participants, presenters today who would be discussing the topics. And the topics really are universal, not only applying to the women professionals. And they each have about 10 to 15 minutes to present. And then we will open to the question and answer session. Please think about your questions as they present and place it in the chat. And we would like to get to as many of them as possible. So without taking too much time, I would like to start with the first speaker, who is Dr. Margaret Tempero. She's from Bauer Family Distinguished Professorship in Pancreas Cancer Clinical Trial and Translational Science at UCSF. She's the director of UCSF Pancreas Center, and she's one of the leaders really in the pancreas field. So I'm very excited that she's here. She's also one of our past presidents of the APA. Margaret, can you please go ahead?
Absolutely. Thank you, Aaliyah. It was a nice introduction. When Aaliyah asked me to do this, my first thought was, I don't want to do another Zoom meeting with a slide deck. And so I didn't get out of doing another Zoom meeting, but I did get out of the slide deck. So I am just going to make my remarks, and hopefully you can take notes. And if you have questions, come back later. You'll notice my title is Building Your Career and Overcoming the Imposter Syndrome. So maybe that was my third question to Aaliyah, like, what is the imposter syndrome? I didn't even know what it was. So Aaliyah was kind enough to send me a bunch of articles. And apparently this is a very important and common syndrome. And frankly, I've had it my entire career. I have never, ever actually thought I measured up to what I was supposed to be. So I'm not sure, Aaliyah, that I ever overcame the imposter syndrome, but I can talk about it a little bit. If you don't think you measure up, obviously you're trying to measure up, right? You're trying to learn, you're trying to be on top of things. But if you don't think that you measure up, you really have only two options. One is to get out. The other would be just to do your homework and make sure that you understand where your talents are so that when you're invited to do something or asked to, say maybe take a leadership position, that you're really honest with yourself about what your capabilities are. But anyway, apparently the imposter syndrome is more common in women and more common in people of color. So at any rate, I hope I've overcome it. At least I know a couple of good things about myself. And I do know that I have some talents in running meetings, in coordinating collaboration, and in running programs. That part I know. Before I get into talking a little bit about building your career, I wanted to just address a couple of things that I think women deal with all the time. One is the sort of balancing aggression versus assertion. And I'm sure you've heard this discussed at other women's programs before, but women often come across as aggressive when they're simply trying to be assertive. They're interpreted as being aggressive. I say, in this, when I think about aggression, I think that's more like when you're intending to harm, maybe by the words that you use, or hopefully not anything physical. But assertion is very different. Assertion is where you simply hold your line, whatever it is. If you're interrupted at a meeting before you're able to complete your thought, don't just sit there. Speak up and say that, excuse me, I didn't get a chance to finish. May I be heard? It's very simple to really, in a nice way, be very assertive. The other area where I think we need to be very assertive is in not allowing unacceptable behavior, whether it's overt sexual harassment or just repeated jokes that involve racism or that are sexually demeaning or what have you. Speak up and say, Professor so-and-so, that what you're saying is making me very uncomfortable. And I would hope that you could avoid doing that in the future. So I think this idea of being assertive is really, really important, and don't be afraid of it. The last thing I'll say that I think women often do, and I'm guilty of this as much as anybody else, is that we often ruminate about something that didn't go right. We think about it over and over and over again, and we relive it in our minds and what we should have done differently. We can waste an extraordinary amount of time doing that. And I think if you just decide, for instance, okay, I made a bad decision, that was a bad outcome, define what you learned from that. Just define what you learned, and then please move on. Because otherwise it really can be a pervasive thing that really interferes with your concentration and your execution of your duties, all of those really important things. Okay, so now, how to build your career. Many of you, I suspect, are in different aspects of academia. Maybe you're even in industry. You may be in clinical research, you may be in laboratory research, but whatever you're intending to do, you have to be sure that you have proper training. You can't just think you can learn it on the fly, and you have to take time for the training. Just to give you a sense of how long I've been around doing this stuff, I started practicing medicine before there were CT scans. I started practicing medicine when you dictated your notes into a little dictaphone with a reel of tapes in there, and then you sent the tapes off to the transcriptionists. So a lot has happened over time, and we were actually expected to learn as we went. But it's extremely inefficient, it's full of pitfalls, and there are now fabulous training programs in clinical science. They may be at your own institution. You may have to I'm sure they are now going to be more and more available through remote learning. But if clinical research is your thing, well, then get the training that you need. If laboratory research is your thing, well, you already know that you have to go through at least one, obviously you have to do pre-doctoral work, but then at least 1 or 2 postdocs thereafter before you're going to be quite competitive for a position. Secondly, and I know Aida is going to talk about this, identify a mentor, and you probably need more than one. You need a science mentor for whatever your scientific area is. You may need a career mentor if you're thinking about moving into things like leadership and other aspects, or maybe it's just balancing your family life with your work life. Sometimes, depending on the project you're doing, you may need a basic science mentor and a clinical mentor. But be sure your mentor is really qualified. Be sure your mentor is senior enough so that your work is your work and not derivative of their work. So you need to be really careful, and I hope Aida will go into this a little bit more, but it's really, really careful how you select your mentor and who you select to be your mentor. The third point is about collaboration. There isn't anything anymore that one can do alone. You need collaborators. And so you need to identify the right types of people who can provide the skill sets that you need and who you can learn from in the research that you choose to pursue. The next thing is focus. I always say when people ask me, should I do this or not? And I say, well, is it getting you closer to your goal? Is it in the same line of what you've been doing, or is it very much a tangent? There's a yin and a yang here, because sometimes unexpected opportunities lead to great things. So you should probably never stay so focused that you don't try something new once in a while. But when I'm looking at a CV, I do a lot of reviews for the state of Texas for the bringing talent into the state. When I'm looking at that CV, I'm looking for focus. I'm looking for a continuum of original research contributions that focus on one particular area. And finally, publish. You're nothing if you're not publishing, because frankly, on the academic side, your CV is you. What's the first thing that I do when I look at a CV? I go straight to the publications, So if you aren't regularly putting out high quality work, that's gonna impede your progress. Now, these are like sort of basic principles, but there are also some tactics that I think you need to think about as you're going about all of this. First of all, creativity. Identify where and how you are most creative. Almost everything we do in academic medicine, whether it's writing a grant or writing a paper, entails some ability to be creative. And you can't write a grant in 20-minute snatches that you grab throughout the day. You have to sit down in blocks of time where you can get your concentration, your juices flowing, you get your mind going, and you start to write. And it becomes very easy when you get into the right situation. I know for me, I have to be in a room with absolutely no disturbances. There's a do not disturb sign on my door, and I have classical music playing. And that allows me to focus on what I am creating, which is usually a grant or some sort of a written piece. So that's number one. Number two is delegate. Delegate as much as possible. We have a tendency to, just because we're good at it, to take on a lot of stuff, but I'll tell you, I don't do my own PowerPoint slides. My assistant does it because he is much better at it, and he is very creative, and he actually enjoys it. And that gives me a huge bunch of time that I can devote to something else. So delegate whatever you possibly can to others. It's not shirking work. It's actually allowing more time for you to work at a higher level. The third thing is and this is again a yin and a yang, but early in your career, it's very important to avoid service, especially service leadership. It's not at all uncommon in the clinical area to have a young faculty member be invited to take on some rather onerous responsibilities, such as running a fellowship program. Well, that's really bad for you. It might sound good in the beginning because, oh gosh, I get a title and maybe they're going to give a little contribution to my salary or what have you, but it takes a lot of time to do those things. So be very, very careful what you assume in terms of service, but do some service. So do things that actually benefit you. So for instance, and I use the clinical trial situation clinical trialist situation quite a lot because that's sort of my world, but for instance, serving on a protocol review committee to learn about what other people are doing, to see what the pitfalls are in these clinical studies, that's helpful to you. That's actually helpful to you. If you're in the lab, maybe there's something in terms of being on a committee for laboratory utilization or for technology assessment. Those things might be helpful. But do avoid early on in your career leadership positions that are service only, because they can kill your research career. I think with that, I'm going to close it out. I know we're coming back for questions, and I hope that was helpful.
Thank you, Margaret. This was a wonderful talk. We really enjoyed it. I think those are really pearls of wisdom and the product of years and years of experience. And I think for someone who's just starting their career, I mean, they're just like golden in my opinion. So we have just one comment, I think, in the chat. We will just move on to our speaker. We are a bit limited in time. We will save all the questions to the end. So I will just go to our next speaker. She has slides, Dr. Ida Heptazian, and again, she's another lady of the pancreas who doesn't really need a lot of introduction. She's a Stanford faculty, but currently at Pfizer as a senior vice president and chief medical officer. She's the head of the worldwide medical and safety at Pfizer currently. So she's going to talk to us about mentoring, which is also another important person, no matter what level you are in your career. Go ahead, Ida.
Thank you, Aliyah, for the kind introduction. And I want to say also, this is great, what Margaret said, very important also to my talk going in here. And so this is the topic that I was asked to address, mentoring matters and how to cultivate a successful connection with your mentor. Next slide, Margie. So I have some slides to keep me a bit more focused and I apologize, there is some noise outside. I don't know, it sounds like a construction, but hopefully you won't hear too much of that. So the first point is, why does mentorship matter and why we are focusing on mentorship today? This is important, as Aliyah said, no matter what level of part in our lives, in our careers, mentorship does matter, and especially, of course, for our junior trainees and faculty. I think a mentor is important because we have not walked, and there is a lot that we can, the wisdom pearl as we heard, and also experiences from other people who have walked that path. So it's like usually we are going into a new direction, unfamiliar territory. So your mentor can serve as a compass. And this is very important, and that has served me well as too. There are circumstances where we all will face and deal with difficult and challenging situations. And this is also where a mentor can help, because to navigate through those difficult times, and not only sailing through the smooth times, but there will be difficult times that we have not seen, we have not been through that journey. A mentor can help us and sort of direct us to the right, or steer us into the right direction. Another reason why to have mentors is, as we heard, is that can promote your career, career promotion and growth. A mentor could be really key and critical part in that too. And there are studies that show, I apologize, this is happening at the time, the noise in the background, but I put some background, references here, but if you do PubMed, actually, you will find in every field that you are, there is someone who's written something about mentorship. It doesn't matter if it's in the basic science or if it is in the clinical or in between. So it has been shown, studies, in fact, including in industry, have shown those who had successful mentorship had a better job opportunity and also better job satisfaction. And then also the other thing is, as we are in this COVID, and this is really important, that a mentor, having the right mentorship can help us prevent those negative consequences. We hear a lot about the quitting, burnout, and dropping out, particularly during this pandemic, and how that is impacting particularly women, junior faculty. When I was an associate dean prior to my leave, that was something that was in fact a very important aspect, as we saw, with the pandemic, a lot of our junior and women were not competitive in the, for example, in the things in academia that we consider competitive in writing grants, etc., because of the burden that was going on. And that doesn't mean, of course, it doesn't affect men, but to highlight that there has been a disproportion there too. Next slide, Margie. So what do we mean by connection, making the right connection? And Margaret touched on this as well. Finding the right mentor is super important. And it doesn't mean that you have one mentor, you can have multiple mentors. And we can certainly, in the question and answer, address those. Is that, so the traditional way is that there is a hierarchical, meaning that there is always a senior mentor. And that's where I was talking about the direction, helping you through difficult times, etc. There are additional mentors one could have. Margaret talked about scientific and career, and this is important. And more recently, what I've learned perhaps also is a peer mentorship that can be added, and we can certainly delve into that during question and answer. So good mentors are actively listening, which means that they are listening to you. And not only are they listening, they're going to act on it and they're going to help you. So someone who's an active listener is a good mentor. However, it's not a one-way street, or it's not one-way direction. As mentees, we also have responsibility that the mentees need to be proactive. And many people have put quotes, and you will find it also a lot if you want to read about it. There's a lot of books that have been written, is that help your mentor help you. And you can imagine that there is a need to set expectations. So sometimes we choose mentors because we admire all the work that they are doing, and rightly so, but sometimes they don't have time because they are mentoring multiple people. So also we have to be cognizant that there is, in fact, when I have this open door policy here, is that the mentor and mentee relationship is going to work because there is going to be time in the mentor schedule. And as a mentee, you have to make sure that, in fact, that is possible. So very important to make and value of the time that you're spending. So be prepared, just like we set a standard in terms of how we do our research, mentorship needs to go also into that. And it's important to evaluate it also on ongoing process or ongoing basis, because it can change. Our careers do change. So many things can change, and we need to adapt. We need to be resilient and change as it goes. It's also important to have a bidirectional feedback. We can be better mentors because our mentees can give us feedback. We are always also, it's also important that we give feedback to our mentees. So it's important to have this setting an expectation, and valuing the time and spending the right amount of time, and having feedback is also very important to make the right connection. Next slide, Margie. So how do we measure success? I always think about, when I think of anything that we institute or anything that we do purpose, whether it's consciously, is that we have a benchmark and that we are in fact evaluating the success. And I think formal teaching, of course, we all know there is a very, like classroom teaching and other types of formal teaching, there is a benchmark and metric, and we can evaluate. In fact, this is one of the important things that we use in terms of promotion. We are promoted on the basis in academic institution. Teaching is an important factor. So there's always a metric, and then there is always, which is evaluating based on the mentor teacher to trainee. And certainly there is appointed protected time for us to teach. And also there are award teaching, and there is faculty promotions that allow development of this type of skill. Mentorship is a bit tricky, right? What is the metrics for successful? But more and more, nowadays we are appreciating. I think there is more awareness and recognition. There are in fact awards to this, and this is why the feedback matters. We need to set also a higher standard or bar for mentorship, because sometimes it lags behind. But of course, we know that mentorship is key. I think that's my last slide, but let's go to the next one. And I think, as Aliyah, you mentioned, we will have a discussion and question and answer at the end. Thank you.
Thank you, Aida. A wonderful presentation, and thank you, the speakers, for staying on time. I know we're a bit limited in time, so I don't see any questions in the chat yet, but I think we will have plenty of time at the end. And again, I think those are very important issues for someone who's starting their career or mid-career, and perhaps even at a seniority level to be in a supportive environment. So, and our session will be concluding with the last speaker of the session, Dr. Sarah Thayer. She is a professor of surgery and currently at Ochsner LSU Health Shreveport, the director of the Pfizer Cancer Center. And she's going to talk to us about how to manage conflicts.
Can you hear me now?
Yes.
Great. I'm going to just say, you're going to find this funny in the middle of this talk. You're going to know that why I say this. I'm so annoyed at technology. But anyway, I just want to ask Joe exactly why. And I'm just going to, if we could share my slides. Okay, great. Can you see me? I can no longer see you guys. So I apologize. Can you see me?
Yes.
Yeah. Well, I can no longer see you guys, so I do apologize for that. But anyway, I wanted to ask Joe whether or not there was some meaning to me getting the conflict management and resolution slide. I may have been criminal of this several times when I was younger, but
You're just so nice. You're kind. We want to know how you do it.
Okay. Well, certainly it is a great pleasure to be asked to participate amongst these wonderful women and to be able to talk with you about something about conflict management and hopefully its resolution. And what I really wanted to talk about is really we have very little control over other people, but what we do have control over is ourselves. So mastering the inner world and what might be going on as we respond to conflict. So I always thought this was a little funny. I have no conflicts of interest. And anyway, so, you know, many of us, actually all of us, experience some sort of conflict. And this could be every day, could be mild. It could be that we actually might be really good at creating it. But what's really clear is if we're going to be successful in life and in our profession, we must learn how to successfully manage and resolve it. Now, conflict, as we know, is a struggle. It's an opposition. It's a contradiction, sometimes a difference of opinion, of ideas. And that's usually where it comes from. It comes from the Latin word com, which is together, and flagere, which is to strike. So, but it does not need to be physical. And I just wanted to talk about there are many, many different types of conflict, but those that arise in the workplace usually involve either conflict with others, that's usually the case, conflict with self, and conflict with environment. And the root cause for many of these conflicts is really a misunderstanding. And from an institutional level, it's usually due to lack of poor planning, poor staff selection, meaning we're expecting things that are not realistic. And that's from an administrative standpoint. However, from a day-to-day personal standpoint, it really can just boil down to poor communication. Be clear and concise in how you deliver your message, and always make sure your message was received and well received, should I say. So now, resolution of conflict requires a fairly substantial understanding, and before you are reactive, you need to actually take a moment to understand the situation that you're in. First and foremost, you need to identify your emotions, your emotional, physical, and relational reasons behind the conflict. And really remember, I remember I was told this, and then I actually didn't believe it for a long time, but really somebody told me one day, and it was one of these consultants that come in about changing our breakthrough thinking. But really, she told me that our reality is made up. And reality is based on our memory. And our memory, she said, is an interpretation of an event. And it's subject to an emotional tie to an idea or belief. And if you think about your memories, it's also always associated with some type of emotion. And we remember the feeling that it gave us, and then we bring back the memory. So in essence, she's right. So really understanding the emotional tie behind the conflict becomes really important. First and foremost, you do need to understand the external work environment. You need to know where you are in this environment and where you stand. You need to understand whether or not this is discriminatory, whether or not there's might be harassment. And you want to understand whether the people and the institutions you're working with are professionals. And you also need to understand the process of effective communication. Whoops. So first, conflict resolution requires you to understand your coping mechanisms. And I think the best way to understand coping mechanisms is to understand what bad ones are. And all of us have either experienced them in our day-to-day events, whether they be in the hospital, in the lab, in a meeting. So things like attacking, when somebody's attacking you, they are basically saying, hey, by the way, you're stupid, this doesn't work, I don't like you. These are the messages. They may not be saying that, but there is an external offensive event to these environments. This is a bad coping mechanism. The other is internal attacking. And this is when you are self-deprecating, and it kind of comes to the mind of the imposter syndrome, right? You're saying, oh, I'm not worthy, this is not good, I hope they never discover that I'm not smart enough. This is the internal attack that you need to watch out for. Women are actually subject to this, and that imposter syndrome is really about you attacking yourself. Guilt is also a negative emotion, but sometimes it can be quite constructive. So you should understand when you're feeling guilt, because you really usually feel bad about something that you've done or behavior that you've exhibited. And this can actually lead to resolution, saying something like as simple as, I'm really sorry. Now, guilt is okay. However, shame is not. Shame is actually very dysfunctional. You're putting yourself down and you're attacking yourself with no place for being self-evolved. The other one that we're all aware of is procrastination. Now, this is just avoidance. And initially, I used to think that the procrastination was not something that physicians or scientists did. But when you take a look at the mechanisms behind procrastination, they're very common in people who have OCD disorders. And that is the majority of the people that work in the healthcare and scientific community, meaning that they have anxiety because they put themselves to such high standards. And so they have a tendency to procrastinate because doing the task opens up a huge amount of anxiety over them being perfect in performing that task. So they end up putting it off. So the other one is denial. I don't want to take responsibility for this. I don't want to think about it. And unfortunately, this is one of the most primal mechanisms. So learn to identify it and try to avoid it. However, these bad mechanisms are, these three actually don't usually come in isolation, and they usually become combined. And you can hear sometimes, whether you're speaking to your child or when you were a child, you're saying, just leave me alone, you're stupid, it's not my fault, I don't want to talk to you. Well, that uses all the bad coping mechanisms. Although these words may not be said in your professional setting, you may want to take a brief pause to see whether or not these are the mechanisms that are being used and to understand this conflict. There is obviously a better way. The other thing you need to do really is to figure out how you are feeling. And this is really tough. I find this feeling identification an important thing to do because it's a little bit complicated. I think you can easily identify mad and sad, right? And glad. So all these three are pretty easy to identify. Anxiety is a little bit more difficult because it comes up and can manifest itself as a fight or flight mechanism. So you need to understand that anxiety can bring out bad behaviors that may mask anger, but really what they're looking at is a lack of control or fear of an outcome. So you need to understand that, because many of our physicians have this feeling of need to be in control. And it really is, the root of it is anxiety. And the other one that I want to bring out is annoyance. Now, annoyance is a thing of its own, and nobody really understands the science of annoyance. And it's kind of interesting when I started looking behind the psychology about what drives annoyance, it's really idiosyncratic and it's super hard to define. And it could be, and some psychologists think it's anger, or it might be mild frustration, or it could be aversion or lack of control. And if you think about it, it can be quite idiosyncratic. So for example, people get annoyed when, let's say you're sitting at a restaurant and the person next to you is on the cell phone. Well, many of us would feel annoyed by that. But that same instance, if the person is walking by us, would certainly not even raise a trigger. We wouldn't even think that abnormal. And so finding out what annoys you is actually a really, really good thing. I find this to be my personal demon when I come into any type of conflict resolution, is to try to understand my personal annoyance. And it perhaps I always put this because it probably is the fact that we can't get away, or its execution and timing is of uncertain duration, or it can be a combination of all the above. But what you need to know, and many of us know it, is it's hard to define, but when you're in it, you know it. And when you feel it, you know it. So understand the necessary components of effective communication. So obviously it starts with these four, acceptance, empathy. Now, when I mean acceptance, you don't need to accept what's being thrown in front of you. That's not what I mean to accept. But I mean, don't judge the situation, because when we're younger, we may be in front of it and we may be asking. And when we're older, we're certainly asked to effectively resolve many conflicts. So the first part is what we need to do is set up an understanding and acceptance, meaning try not to judge what's going on. And the second thing is empathy. Empathy does not mean sympathy. I feel bad for you, but empathy means I understand where you're coming from. And if you can put yourselves in their shoes, you can understand some of the issues that are being brought up. If you can have acceptance and empathy, this gets you connection, and ultimately connection gets you better, more effective communication. How many of you have understood that when you're in a situation and you feel that you haven't been heard, you get louder and iterative and more demanding? And the reason why you're doing this is because you feel misunderstood, or you feel that you haven't been heard, or your cause hasn't been heard effectively. And so understanding and empathy gets you a long way, because how many of us have accepted bad consequences, really bad consequences, but we were happy to acknowledge them because we understood that our point and our point of view was actually considered in this decision. So again, acceptance and empathy gets you connection, and connection is what gets you communication. So really remember also, I was actually quite impressed to see what percentage is verbal and nonverbal. So remember, what you say is important, but what you do is even more important. What I was surprised at, 35% of a message is actually verbal, but 65% is nonverbal, meaning what we're paying attention to is a physical cue, such as gestures, eye contact. You always need to be aware of what you're doing, and you always need to make sure that you understand that your physical cues dominate your message. So how many of us have been in a conversation where we're doing, your person you're talking to is doing this, and you know full well the message that they're sending is, I really don't want to be here. I really don't have time for you. And I don't really care what you're saying. That's the message that gets through, even though you may be, right? You may be saying, I'm waiting here, we're talking, right? It's be very careful what you're doing. Now, remember, taking turns is really important. And I really kind of always laugh a little bit about this, because many of us wait for the conversation to stop and pause, and then we try to jump right in. However, they may not be done. And so we have to be very careful to make sure that we allow enough time for the other person, even if they're pausing, to finish their idea and statements. Because what you actually do want to ask is, are you done? And is it okay for me to respond to some of your suggestions and or concerns? I think that is really appropriate. And when the discussion becomes heated, nobody's really listening and we're talking over one another. And ultimately the goal is you need to back it down or even take a break. The goal is, how do you know when you've been heard? Now remember, if they can restate it, right, then you know you've been heard. But remember, really, what are you communicating? Like, let's take that message. If I went like this, yeah, and then they said, hey, did you hear me? And I'm like, yeah, no problem, I got it. Yeah, I heard that you need more research money and you needed 20% more time to get your work done. Yeah, no, I got it. But what did I really communicate? I didn't communicate concern. I probably communicated a very different message than what was intended. I value your work. Yes, I believe in your work. Yes, I will love to get you 20% more time. Also understand that silence is also a powerful tool. And here's the other one. Remember, we're talking about connection, and sometimes self-disclosure can facilitate open communication. And you want to make a connection, but make sure you just don't say too much, because you know when you said TMI, because ultimately you don't want to say so much that they believe that you need the attention and help and you need the psychotherapy. So careful with the self-disclosure. You don't need to make yourself bare to these people when you open communication. Remember, and I think Margaret also started to talk about this, is communication is also about your confidence and assertiveness. What do you think are the chances that if you never ask for what you need, somebody will give it to you? Well, that is about zero. Always remember, nobody's a mind reader. And remember that the fact that you need to be able to communicate effectively. Being passive basically can also translate into never getting respect. So don't be too passive, but most importantly, don't be aggressive. Now, assertive is not aggressive. And some people take an aggressive tone when they are in the middle of a battle, or when they're in the middle of thinking something is unjust and they go to ask for something to change. Just remember that your IQ and aggression are inversely related. So this came from the psychologist who looked at angry children. And sometimes I think it's very appropriate that we look at that body of literature. But did you know that aggression only works 15% of the time? Meaning if you use an aggressive tactic in conflict, only 15% of the time you're actually going to get what you want. So remember that. So by pure statistics, don't use aggression. Also, let's say you get angry, right? And you're in the middle of an argument. Your IQ drops precipitously. So for example, the average human being has an IQ of 100. And let's say you get angry in a discussion and you really get angry and you pound the table and you are aggressive and you maybe really talk loudly at somebody. Do you know where you are in effective age? So every time you get angry, you drop your IQ about 15 points. And if you really get angry, you drop your IQ about 30 points. So effectively taking a person with an average intellect of 100 and taking them to approximately 70, which gives you the effective age of like a 10-year-old child. So don't do that, because when you get angry, you've lost your ability to make cogent argument about what you need and want. So be quite careful about that. Be assertive, but don't be aggressive, meaning say what you mean and mean what you say, but don't say it mean. So that's the key thing. Also, don't be passive aggressive. And passive aggressive means something different. Have you ever been in a meeting where they're saying something, and they're in a big meeting, they're a group of people, nobody says anything, and then you all leave the room and that person basically just explodes with anger and frustration? Well, that's a little bit of passive aggressive behavior. You need to identify that. And so when you are in a meeting where you think that you have real concerns about an idea, bring that up, because that's assertive, not passive aggressive, right? So remember that these are certain cues that we are all in, and then unfortunately can sometimes perpetrate. This is the thing about the professionalism and anger. So remember, respect others, be self-aware, don't get angry. Remember, regardless of where you start, you've fallen far when you start getting angry, so don't do it. So I probably took a little bit longer than I wanted, so I do apologize. Regardless of what type of conflict you're in, understand your ability to see the real reasons for your conflict. Really, that is the first and foremost. Understand how you feel about that conflict. Understand your coping mechanisms and your inherent behaviors. And more importantly, your prejudgment, right? If you don't like something, you've already prejudged it. So try to keep that away when you're going in for conflict resolution. Start with the necessary components of effective communication. That's acceptance and true empathy. I see where you're coming from. Be assertive, not aggressive. And remember, acknowledge your external environments, but control your internal environments. And the message is, say what you mean what you say, but don't be mean when you say it. And I wanted to thank first Mark Coburn, who actually is a professor of clinical psychiatry. And I think that he's also the director of student counseling. And as you get higher and higher in your leadership roles, you'll be asked to resolve many conflicts. So it's really good to understand how these conflicts arise. And of course, GAP International, who basically work on breakthrough thinking and how we can get beyond our present thinking to achieve better outcomes. And that is it.
Thank you, Sarah. Wonderful talk. And thank you, all the speakers. This has been wonderful. We all learn a lot from you. So we have some questions and comments accumulating in the chat. So I'll see if I can start asking you the questions. So we have one. I think this is mostly for mentoring. So Maria Sabatini says, I do not know if one of the graduate students will be able to complete the thesis. I'm debating if I have to do the work to help him or ask him to do the work himself. How much effort should I need to put to move the project forward? What is the right balance? So I think this is like, I mean, how much do you do for a mentee, perhaps, when things are not going the way they should? Aida, do you want to take that one?
Sure, Alia. So I think we will all face, if you haven't mentored enough, you haven't seen this problem probably. So I think that's a tough one. So I think you have to sit down though, to sit down with the trainee. I think this is where the communication, I think this is what I meant by it's a process. Right. So I think discussing, this is how much work needs to be put. And, when we think about a project, we are talking already about someone spearheading it as a first author. But if that person can't do it, then of course it's going to have to move to somebody else, because also your career cannot be on hold because the project cannot be finished. But it's very important to establish that relationship from the beginning. This is why we are having this discussion, is it should be the moment that, we take mentees into our, we should be discussing, we should be having an open dialogue of what is expected. Of course, research changes over time and we need to adapt, and we need to treat mentorship to the same standard as we do when we are making our CV, when we are thinking of projects and who's going to be the first author, who's going to be senior, who's going to be in the middle. This used to come up also when I was an associate dean, in terms of looking, because it's important also for your promotion as it is important for the trainee. So I would say having an open dialogue, this is what remains, this is what needs to be done, and then continue that conversation. Then of course that trainee, if maybe what is the problem, understanding why we are in the situation that we are, but let's try to prevent it early by having, again, that open dialogue. But I would say the project needs to move on, and maybe give also that trainee a chance to explain and what's going on. So there may be more to it, is what I would say. So I would sit down and try to have that dialogue.
Thank you, Aida. I think For the interest of time, I will move to the next question. That one is also for you. So this is an early career scientist in basic research and having difficulty finding mentors. So I think the question comes to, how to best, I guess, express herself as a mentee. If you have issues perhaps with expressing oneself and finding the connections, do you have any idea about how to advise a person who's just starting their career to find mentors or connections, perhaps not even in the same profession, in career and professional development?
Thanks for asking, and especially thanks for participating. You've done already a great step forward by being here, because that's why we are here, is to discuss this topic. And I think it mentions that this individual is an introvert. So I have to say, being an introvert and extrovert, the fact that there is awareness, this is something that all of us need to evaluate. I used to be a very extreme introvert that is now moving close to the extrovert, right? That's what we want to do. And if you're an extrovert, so there is a balance, right? If you're an extrovert, you need to learn to listen. If you're an introvert, you need to speak up, right? So we need to work on that. But in regards to finding mentorship, what I would say is that, connection, try to get yourself out there. For example, you mentioned advisors, right? Scientific advisors. I would say come and present at APA. I'm assuming you are in pancreatology field somehow, or in anywhere. There is, all societies now have the ability, we are talking about this, of course, for training, a platform where you can present. And this is one way you can meet mentors. The other thing is also looking at your peers, who is, getting good mentorship. This is another way. Basically, it's to put yourself out there and to ask questions. And certainly here at APA, that is the goal. That's why we are having this. Talk to anyone at APA. A lot of our emails are public. Reach out in the way that is most comfortable to you, because if I can't mentor you and I don't have time, I may suggest somebody. And this is why I would say just reach out like you are doing today. And thanks for being aware of this, because you've made a big step already. For an introvert, that is a big step, and come to APA.
All right. Thank you, Aida, so much. The next question is for Margaret. So I think this has also been brought up as a comment by another participant. So the balance between being judged as aggressive versus someone who's assertive. So how do we balance that out? So this may be coming up for someone who is a minority, someone who is a women faculty. So how do we balance that out without being judged as aggressive?
So I go back to what I said before, is that if you feel that your words are leading to something that could cause harm, like for instance, I don't think you conducted this research properly, you should have used a different control arm. What if you flipped it around and said, do you think your results would have been the same if you had used a control arm like X? So I think we have to start asking yourself, is my question going to sound threatening, or is my question going to sound like I need more information? So I think that, to me, that's one way of sorting that through. It's not about your tone of voice. It's not about how loud you are. It's really about what your words are. What are your words? And being careful about that.
All right. Thank you, Margaret. So the next question is about Aida. So someone is wondering what drove you to work in a non-academic setting at Pfizer. So what got you interested?
That's an evolving process. Thanks for that question. As you know, I think my career in academia was going well and is going well. So it wasn't something that I had thought about it, but opportunities sometimes come knocking on your door. And I just happened to open this one, and I was curious. So curiosity has always been a passion of mine in terms of, and I found it to be a moment of growth. Certainly, it requires courage because I would say I've grown in the academic world, and that's where I'm comfortable, as a tenured faculty and so on, and everything going well. But I think when this opportunity came, one of the things that I learned is I was trying to do a lot of translational research. And in pancreatitis, the frustration for me was that how come we don't have a drug there? How come we don't have a therapy for this disease and so on? So then I discovered that, through this opportunity, and at the time while Pfizer was developing the vaccine, in my conversation was that they are interested in transformational and breakthrough therapies and preventions like the vaccine. So it resonated to me, and some of the values that were discussed. In fact, the values for Pfizer are, in fact, it's courage, excellence, equity, and joy. In fact, I'm now starting a health equity initiative because that also is very close to my heart. I have a background in global, I've lived in many countries, an immigrant, a previous refugee. I've always been interested in how, when I retire, that I would do global health. So this came early for me, so I couldn't pass it on, and I wanted to explore it. For all these reasons, it felt, it's something that I need to do a jump, have the courage, and see where it leads. Thanks for that question.
Thank you, Aida. That's wonderful. So the next question is for Sarah. So if there has been struggle in the past with conflict management, and potentially this person burned bridges with the other person, could it be a redo? Could it be a rejuvenation? So if so, how can someone do that?
So first and foremost, I don't think that any one of us have gone through life and not burned a bridge, or not have put ourselves in the situation where perhaps we went into conflict. We chose a win or lose situation, and one person was the winner and one person was the loser. When you do that, you do know that you have in some way burnt a bridge. It may be large, it may be small. The first and foremost thing, is, of course, depends upon the magnitude of that bridge. And the first and foremost thing that you should know is how and why you did it. I think first understanding why you did it and what was the importance of winning this particular conversation or this particular conflict. Why was it so important to you? Understand that first. And first and foremost, nothing, is beyond too late. First and foremost, if you go forward, learn from your ineffective communication strategies, you can use them as powerful tools and learning tools for the future. Remember always that repairing yourself really and your reputation is just stepping forward and doing better going forward. You can't do anything to go back, but what you can do is either apologize for it or make sure that the things that you've done in the past don't repeat themselves in the future. The other thing is always remember that it's a conversation. There is an interesting Harvard Law School has this class about communication, and actually it's all about winning an argument. And unfortunately, Dr. Warshaw let me take parts of it. He wouldn't let me take the long course on it, not too surprisingly. But what they really said is, even when somebody says no, right? Let's say you're saying something and they say, absolutely not, I can't do that right now. If you stay in the discussion and you stay talking, say, okay, does that mean that if I can do X, Y, and Z, I can do better? Meaning if you're always willing to come back to a conversation and you're always willing to change the paradigm, there's always discussion. And where there's discussion, there will be a different outcome. So this is another thing about conflict when somebody says no to you. And the fact is, if you say, okay, and you walk out the door, it is over, right? It is. If you don't ever re-engage with this person, don't show them that you're different, don't basically either apologize or basically understand what went wrong in that relationship, professional or not, then you will have effectively burned that bridge. But if you have and you've learned and you want to mature from it, there is certainly great opportunity.
All right, wonderful. So it's the top of the hour. I don't see any other questions in the chat box. This has been a wonderful session. So please attend the APA in person and attend the women's program. This has been wonderful, but when attended in person, it's really fantastic. People participate and there's wonderful discussions. Again, it's been wonderful. It's been really a privilege privilege to really moderate this wonderful group of people. I learned a lot, and thank you for attending. And this is recorded, and it will be available for review later. And thank you, Abby, for sponsoring, and thank you, APA, for making this possible. And thank you, everyone. Have a good evening.